In this video, I'm going to talk about what you really need to do before a facet injection. We often do facet injections for the small joints in the lower back, which are formerly called zygapophyseal joints or just simply called facet joints. These joints can become painful and arthritic like any other joint in the body. Often when these joints are painful, people have pain with standing and walking and often feel better with sitting. These procedures are usually done under x-ray guidance called fluoroscopy. That way we can see that we're placing the medication right inside the joint. The standard of care for the treatment of these joints includes either injecting steroid into the joint or doing this radiofrequency ablation procedure, which cuts off the pain signal from the joint to the brain. We are also able to use a regenerative treatment option for this to help shut down the pain and help minimize the progression of the arthritis. So before you commit to any of these procedures, we want to make sure we have done an excellent job working on the mobility of the pelvis. Not just jumping through the hoops of physical therapy, but actually making a solid effort to improve the pelvis mobility. Most joints, if stabilized correctly, can help minimize the pain from arthritis. This is often a balance between strengthening things that get weak and loosening things that get tight. One common problem I see with patients with facet arthritis is that the hip flexors are often very tight, and that's from sitting a lot of the day, which usually occurs because standing and walking the pain is worse, so they feel better sitting, so they spend more time sitting. This can lead to a very bad downward spiral that can lead to progressive tightening of hip flexors, limited by back pain, and worsening of sedentary lifestyle. The problem with the hip flexor tightness is it doesn't allow the pelvis to tilt all the way up, and so that forces the lumbar spine into further extension. And if the facet joints are irritated and arthritic, extension of the lumbar spine puts more stress on those joints, so it's more painful to be in that position. This also goes hand in hand with core and glute strengthening, and this is something that needs to be worked on every day or every few days to keep things in check if facet joint arthritis is a problem. Remember, just because there's arthritis in the joint, it doesn't mean it has to be painful. So just keep working on improving biomechanics, keep working on nutrition, and if necessary, there are interventional procedures that can help with the pain. Until next time.